This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about chronic inflammation. Inflammation is one of those health buzzwords that seems to be everywhere these days. It's blamed for everything from joint pain and gut issues to heart disease, fatigue, and even brain fog. But what exactly is inflammation? When does it help the body heal? And when does it harm the body instead? Is it possible to experience chronic inflammation without even realizing it? To cut through the confusion, we're talking with Dr. Vanessa Kronzer. She's a rheumatologist at Mayo Clinic in Rochester, Minnesota, and an expert in inflammatory arthritis. Her research focuses on what drives inflammation and how we can do a better job of treating and preventing it. Dr. Vanessa Kronzer, welcome to the show. Thank you so much for being here.
Thanks so much for having me. Excited to be here.
We are going to start with the basics. So, what is inflammation exactly? What causes it?
So inflammation is our natural immune system's response to injury or infection. So all sorts of different things can cause it. For example, pathogens like bacteria or viruses, trauma like getting injured or getting a cut or wound, irritants like you get some chemical or dirt or something in your skin, or autoimmune or autoinflammatory diseases, lifestyle things like obesity, smoking, stress, poor sleep. Lots of different things can incite this natural immune response.
And what exactly is the immune response? When I think of inflammation, I think of puffiness or something getting red and swollen. What specifically is inflammation in the body, though?
So it's part of the immune system. There are actually two parts of the immune system. There's the adaptive immune system, which is like our B cells and T cells that learn and fight against things that it's recognized and seen before. And then there's the innate immune system, things like macrophages and neutrophils that are designed to respond to anything. Whatever comes up the first time, they're just going to be there and fight it.
Okay, so inflammation is the body's reaction to something that's upsetting it. And what we think of as redness or puffiness might be just one manifestation of it. But let's say I have inflammation. Isn't that a sign things aren't going well? My body wouldn't be going through inflammation if things were going great, right?
Well, that's what it's supposed to do, is to fight injury or infection or things that aren't supposed to be there.
I'm guessing what you're referring to is maybe short-term inflammation, which maybe can heal us?
Well, yeah, if it's in response to something like an injury or infection, that definitely helps us heal. So that's a good thing. But if the stimulus remains present, even if it was good in the short term, that's when the inflammation becomes chronic. That's what chronic means, is it lasts for a longer period of time.
So in one case, it might be like, oh, my body's been infected with something, my body's reacting, I'm getting through it. Yay, everything's fine. But chronic is ongoing.
Yep, exactly.
It just seems like our bodies, they work so hard and they're trying to do the right thing. But then it's just like, there's too many fire engines in this house right now. There's 800 fire engines and we just needed one, is kind of how I imagine it going, where now the fire engines have kind of destroyed the house.
And that's actually how we put it to patients, is like a fire that we just need to put out. The sooner we put out the fire, the less damage you get.
And then inflammatory diseases. You mentioned those. What are some examples of those?
So there are both autoimmune and autoinflammatory diseases that are both the consequence of overactive chronic inflammation. For example, autoimmune diseases include things like rheumatoid arthritis, which is the area I do research in. Also, autoimmune thyroid disease, type 1 diabetes. These are common examples. Autoinflammatory conditions, an example is Crohn's. My husband actually has that one, or gout. Those are examples of inflammatory diseases that are chronic.
And what exactly is the difference then between an inflammatory disease and an autoimmune disease?
They're actually on the same spectrum of
Oh,
immune system
okay.
disease, with
Okay.
autoimmune being at one end of the spectrum, autoinflammatory being at the other end of the spectrum. What distinguishes them is that autoinflammatory diseases are primarily that innate immune system that I talked about, which is that fast first line of defense, but nonspecific. Whereas
Hmm.
at the other end of the spectrum are autoimmune diseases. This mainly is the adaptive immune system, which is slower but more specific. And it generates these antibodies, which are proteins that are supposed to fight very specific infections or bacteria. But in autoimmune diseases, they become overactive for reasons we don't really know. But that's why you can pick up blood tests for them. Things like B
Mm-hmm.
cells and T cells. They make these autoantibodies that you hear about as blood tests. For example, if you've heard of rheumatoid factor for rheumatoid arthritis,
Hmm.
or
Hmm.
TPO antibodies in thyroid disease. Lupus is a condition that's very adaptive immune system driven. If there's an antibody blood test, that's a sign that it might be more of an autoimmune type disease.
Something I hear people talk about a lot in the context of autoimmune diseases like Crohn's, for example, is flares. For those who don't know what a flare is, that means something's acting up, right? It's flaring up. Is this something most people with inflammatory diseases experience?
I think that's a common thing for many autoimmune, autoinflammatory diseases. In the rheumatic diseases, I can't think of one that is not characterized by flares. Rheumatoid arthritis, lupus, vasculitis, gout, all of them are known to have periods of being better and periods of being worse. And for the ones outside of rheumatology that I know of, I think even those are characterized by flares too. For sure, Crohn's is. I'm thinking even multiple sclerosis. It varies by the person and their own patterns are unique, but as a disease group, it's very common to experience flares. Some people individually never have flares. Some people no symptoms at all between flares. I would say more commonly, people just have less symptoms between flares, but they're still there. And then there are other people who are in a flare, but it seems to never get better, like just a
Mm.
continual flare. So I think it's a spectrum and can be anywhere along that spectrum.
Now, it's been reported that the prevalence of disease associated with chronic inflammation is expected to increase over the next 30 years in the US. Why is that?
Well, one thing that contributes to that is aging. We know that aging is associated with an overactive inflammatory state. There's actually a word for that. It's called inflammaging. Other things are obesity and stress levels. These are contributors to chronic inflammation that are also on the rise in our society. This is
Ah.
personal speculation of mine, but I also suspect that less time that we're spending outdoors is also contributing. So I'm starting some
Mm.
research in this area, but there's some early evidence that time spent outdoors can improve our immune system and reduce inflammation. And as we all know, we're spending a lot less time outside than our ancestors did, and I think that might be contributing as well.
What is it about being outside? Is it the vitamin D from the sun? Is it the stress reducing effect of being in nature or of walking?
It could be a lot of different things. It's really an untapped area that we need to learn more about. I don't think it's just one thing like vitamin D, for example. My guess is it's a compilation of a ton of different things, and we have yet to discover what all of that is.
Inflammation is the body's natural response to injury or infection. In the short term, it's a good thing. It can help your body keep a cut from getting infected or fight off a virus. But when that inflammation lasts a long time, it starts causing problems. Chronic inflammation can lead to autoimmune and autoinflammatory diseases. Autoimmune diseases are when the immune system creates antibodies that target specific areas of the body. Autoinflammatory diseases are when your body's initial line of defense gets activated and attacks your body more broadly. But you can also experience chronic inflammation without being diagnosed with an inflammatory disease. So let's learn more about what chronic inflammation and inflammatory diseases look like, and some of the gray areas in between. Let's talk about diagnostics. What are some signs of chronic inflammation? What does it look like in the body?
Well, chronic inflammation itself is not a disease that you would diagnose per se, but a process that contributes to developing inflammatory related diseases. Now, what are the symptoms that unite these inflammatory diseases that are known diseases? A lot of symptoms are shared across these diseases. For example, fatigue, fever, night sweats, weight loss. But these are all nonspecific, meaning lots of things can do this.
Are there any non-physical symptoms like brain fog or confusion or things that aren't necessarily easy to physically experience or see?
I think that's possible, but those are even more nonspecific. So those aren't very useful clinically when people have them because so many different things can do those.
That makes sense. We've talked a little bit about the symptoms, but let's talk about the effects of continued chronic inflammation. Over the course of months or years, what effects do you see?
It does increase the risk of all sorts of different conditions and diseases. For example, it increases the risk of autoimmune diseases. It increases the risk of cardiovascular diseases, certain cancers, GI disease, mental health conditions too. I think the evidence is strongest probably for diabetes, depression, dementia. We did do a study showing that individuals with rheumatoid arthritis, one of the chronic inflammatory diseases, they had a 30% increased risk of developing dementia. So we know that there's that association for sure. Regarding cardiovascular disease and cancer, that's why we as rheumatologists recommend treating rheumatic diseases like rheumatoid arthritis, lupus, even when they're mild, and people aren't having a lot of symptoms from the disease themselves, because we know that active untreated inflammation still increases the risk of other complications like cardiovascular disease and cancer that we don't want them to get.
Can you explain more about how chronic inflammation leads to other diseases? You mentioned that it can lead to diabetes, for example, or even cancer. How does it go from something problematic but not deadly into something that sounds really dangerous?
I don't know that anyone really knows the answer to that. These are observations that have been made, and now we need to figure out why.
Got it. And how widespread are inflammatory disorders or diseases?
Well, it depends on your definition of an inflammatory disorder. I think most deaths in our population are from cardiovascular disease, cancer, diabetes. It's hard to figure out what proportion of those deaths, though, are from inflammation per se versus something else. If you focus more on autoimmune disease, a recent study in the UK suggested that 1 in 10 individuals in the general population lives with an autoimmune disease, 13% for women and 7% for men.
Do we know why there's that difference between the sexes?
We don't really know. There are all sorts of hypotheses, from hormones to the X chromosome. Perhaps it's an evolutionary mechanism that women have perhaps a higher level of immune functioning in order to help give immunity to the babies from breastfeeding. But that comes with the consequence of the increased risk of autoimmune disease. That, too, though, is really a question that has yet to be figured out.
Oh, that'll be interesting to see once we know more answers. Now, is there a specific test that we should take if we suspect we might have inflammation, an autoimmune disease, or inflammatory disease? Is there like a blood test, something else that just makes it obvious?
Well, again, chronic inflammation, we don't at least currently classify that as a disease. So there's no particular test for that per se, but there certainly are for the known immune-related diseases and conditions. Obviously, there's a huge spectrum of those. And that's where primary care doctors are really helpful for screening and determining if there's any specific symptoms they would be concerned about. I can speak best to rheumatology as a rheumatologist, and I will say that the red flags that we get concerned about are joint pain lasting more than 6 weeks that's worse in the morning, more than 30 minutes, usually more than an hour. Night sweats requiring actually changing sheets or pajamas at night, unintentional weight loss, and then Raynaud's, especially if it develops after age 30.
And just a moment, what's Raynaud's?
That's where fingertips or toes turn white as a sheet in the cold, usually with a sharp
Oh,
cut off. So if you Google the
okay.
word Raynaud's, you'll see a picture, because a lot of people say, oh, maybe, when I ask them, and then I show them the picture and they're usually like, oh, no, it's not that. But if the primary doctor thinks there's no specific disease currently that needs to be screened for, then great. Though it's still a good idea to reduce inflammation to reduce the risk of getting one.
Got it. Now, you said that it can be kind of hard to tell the symptoms apart when we have inflammatory disease. Are there certain symptoms people should look for in themselves or pay attention to if they suspect inflammatory disease?
Well, it depends on the which one, because there are dozens and dozens of different ones. Something that comes to mind is that one condition that's pretty common in rheumatology, it's called spondyloarthritis. It's kind of a mimicker of rheumatoid arthritis, but it's trickier to diagnose because it's more on the autoinflammatory end of the spectrum, meaning there's no blood test, antibody test for this disease. And the other thing that's tricky about it is that the inflammation markers are not always as high as they are for rheumatoid arthritis. So basically, the blood work can look pretty normal in a lot of people, and yet they still have this joint pain and swelling. So this is a disease that's really a clinical diagnosis based on history and physical exam. I see that one getting missed the most, I think, because the blood tests are more often negative for those people. So I see tons of patients with this, just one who came in yesterday where they're having pain, stiffness, worst in the morning, in his hands and in his feet and in his back. And he was seen by a rheumatologist 5 years ago and they said, nope, you don't have anything. But then it's continued and it's been getting worse. So I got blood work, and again, the inflammation markers are normal, but the platelets are high, which can be an indicator of inflammation that just hasn't gotten severe enough to elevate those inflammation markers. So I did diagnose him with spondyloarthritis.
Oh, that must be so frustrating for the patient and such a relief when somebody like you can say, actually, this is what's happening.
Honestly, I have this encounter with people so often. You don't want to have one of these conditions, but they're just so happy to finally know what it is and be put on a treatment. And this is why I love helping people make that connection after often so long.
While many people have chronic inflammation, it's not an official diagnosis. That only happens when it becomes a specific autoimmune or autoinflammatory disease. And part of the reason chronic inflammation and these diseases are so hard to identify is that the symptoms are vague. Things like fatigue, fever, night sweats, or weight loss, for example. If you suspect you might have an inflammatory disease, your doctor can help you figure out what tests you need to rule out or confirm a diagnosis. We still don't know exactly what causes inflammation to progress into an inflammatory disease, but we do know chronic inflammation is important to address. Having long-term inflammation and/or inflammatory disease increases your risk of developing cardiovascular disease, certain cancers, GI diseases, and mental health conditions. So, how do we avoid these consequences? Let's learn how to tame chronic inflammation. Let's talk about how folks find relief from chronic inflammation and inflammatory diseases. What treatments are there for folks who are coming to you?
So it depends, obviously, on which condition they have. For rheumatology, I'll give you the disclaimer. I think that oftentimes medications can do more harms than we recognize, more than the benefits in some cases. But for the autoimmune and autoinflammatory rheumatic diseases that we diagnose, I would still say that unfortunately medications is the best first-line treatment because the data shows that it's the most effective treatment. A lot of people ask about supplements. We actually did studies on this, and we actually surprisingly found that supplements were associated with, if anything, an increased risk of autoimmune diseases. And there are a couple other studies that suggested that might be true as well. So what I tell people now is to avoid them unless we know that they're deficient in something. From an evolutionary standpoint, it's not something that our body was used to getting. It makes sense that something would not be good for us unless we know that we're low. And then other non-medicine things that can complement are what I call a triangle of 3 different things: diet, exercise, sleep, and then spending more time outdoors. Even just 20 minutes spent outside was shown to improve our immune cell composition.
With some other autoimmune disorders, are the medicines going to be the same or different?
I would say it's individualized to the disease. Every disease has their own different set of recommended medications.
So autoimmune diseases like Crohn's or rheumatoid diseases, lupus, and so on, those may have one type of treatment, but other things like asthma might have totally different ones.
Exactly.
You mentioned earlier lifestyle modifications complementing other treatments. How do you approach those with your patients?
That's where I really come back to the triangle of diet, exercise, and sleep. There are books that changed my life in each of these areas. And for diet, called How Not to Die, it's an amazing, very reader-friendly review of what the data says about diet and its relationship to a variety of diseases, including inflammatory diseases. For sleep, I think something for everybody to consider improving their sleep hygiene to reduce their inflammation, among a variety of other health benefits. And then for exercise, there's a book called Built to Move, and it talks about the different things you can do to keep yourself moving and active into old age. One thing that it even talks about is how a lot of societies where people are active and healthy into old age, they spend a lot of time sitting on the floor. They eat on the floor. They squat when they do things. And so as a result of that book, people laugh at me, but we now have a Japanese dinner table at our house, and we sit on poofs on the floor now to help our knee and hip mobility and strength so that we can live a healthy life long term.
That does force you to move more and stretch in a different way. It's twice the distance of getting up and down off of a chair, right?
Yeah, exactly. It's been a really positive change for us. I'm already better with my squats.
Oh, that's great. There are certain things we can control, like our diet, getting more exercise, and so on. But are there some things that are out of our hands when it comes to inflammatory diseases, like genetics or the environment?
I think some of it is out of our hands, but that varies by disease. On average, it's about 20% genetic, meaning 80% of it is things that presumably we can control. We also know that the prevalence of a lot of them have been rising dramatically in the last few decades, which suggests that a lot of it is in our control and something that we are doing differently that we weren't doing before.
That's a pretty good ratio, 80% we can control. Those are good odds. I would take those to Vegas. All right. So have you personally seen someone make a significant difference in their disease by focusing on the things they can control?
I can give you the example of my husband who has Crohn's disease, which is a different type of autoimmune autoinflammatory disease outside of rheumatology. He was diagnosed when he was 9 and had very severe active Crohn's disease. And even when he was on meds, he was still having flares, though. So it was a struggle for a long time. And then we actually turned to diet because we were like, what else can we do? But as we reduced the salt, sugar, meat, things that have evidence that suggests that they might be pro-inflammatory, which unfortunately he loved. But as we reduced them over the past 5 years, his symptoms have undeniably improved. And he has been able to stop one of his meds. And he actually, for the first time in his life, had just a routine colonoscopy instead of one triggered by disease. And the proceduralist told him it's the best his colon has looked since 1997 when he was 9 years old.
That's incredible. All from reducing salt, sugar, meat. Are there other things that should be reduced too to have a healthier anti-inflammation diet?
People ask all the time about diet and what parts of the diet are important, what's most effective. What came out of the research that we've done and seen Less salt, less sugar, less meat are probably the most important ones to reduce. On the other side, increasing fruits and vegetables, increasing herbs and spices. Actually, the randomized controlled trials that have been done have been for herbs and spices and show positive benefit. Nuts and legumes. And then patients also ask specific diet name, like which diet type is the best. And we found that it didn't really matter which diet type.
You mean like Mediterranean versus the Japanese diet, or?
We studied it for rheumatoid arthritis, and the ones that have been published on are the Mediterranean diet, the anti-inflammatory diet, and then the healthy eating index, which is basically alignment with the U.S. dietary recommendations. And we found that all three were effective in reducing rheumatoid arthritis risk and severity, and about to the same degree. So what we concluded is that it's not really the diet type, but more just following the general pattern of whole plant-based healthy foods, reducing processed foods, that kind of thing is probably what's most effective.
Is there a link then between our modern processed foods and inflammation and autoimmune disorders we're developing right now?
I personally think so. Across the world, when countries become developed, that's when they start to have a higher incidence of these autoimmune and autoinflammatory diseases. Obviously, a lot of things come with a developed society, but diet is one of those things that changes dramatically. And there are certain diseases where there's growing and very strong evidence about the role of diet. There's huge data about the role of diet in Crohn's disease. And there is some for rheumatoid arthritis too. I wish there was more data, and that's why I'm trying to generate some of that, because I would say there's good evidence so far, and I think we should do more.
You mentioned exercise, stretching the hip flexors and other parts of the body, squatting and so on. Are there other exercises that you do or that you recommend your patients do?
So what I tell people is that we know exercise is good. There's no evidence for one over the other. So whatever they are more likely to do is what they should do. And probably most effective when incorporated into lifestyle. Anything that can be incorporated in your day-to-day life. I take the stairs up to my office and down every day. I bike to work and bike to drop off my kids. So anything that people can do structurally to make sure that it happens like that can be helpful as well.
That makes sense. You don't have to take time out to do it. You don't get a special outfit. Just build it into the day. So you've told us a few things you and your husband are already doing that seem to be helping with inflammation and making you healthier. The diet, spending more time in nature, eating at floor level. Anything else that you have been doing personally to reduce and or avoid inflammation?
I would say the other one that I think is potentially most impactful is the sleeping. I knew that I felt better when I slept more, but I didn't realize there was such high quality evidence that they don't teach you in med school. Very impressive longitudinal studies about how important sleep is, not only for your immune system, but also for all sorts of other outcomes, cardiovascular disease, cancer. So I think that's another high yield personal lifestyle change or intervention that can really help reduce inflammation.
I'm a big fan of sleep. I hope that all the studies say we should all spend more time in bed. I'm fine with that. Now, if someone gets the right medications and makes the right lifestyle changes and their symptoms have completely gone away, does that also mean those patients are technically cured, or can you not be cured?
Well, cure means eliminating disease so it doesn't come back. And the rates of cure depends on the disease. For rheumatoid arthritis, we know about 20% of people are able, after a few years of treatment, to stop medications and have it not come back. So I guess you could call that cure. For Crohn's disease, it's a little bit lower, maybe about 10%. That being said, I'm hopeful in the future that number could be higher, maybe novel medications like CAR T cells. This is a fairly new treatment that appears to be something like a cure for patients. It's like a modified T cell that is supposed to specifically target those cells in the immune system that are overacting and causing the problem. Or perhaps nature therapy, which is something I'm interested in developing to try to treat the root cause of why inflammation has occurred in the first place.
Can you tell me a little bit more about the nature therapy that you're diving into?
So just kind of by a random serendipity in life, I ended up getting mindful outdoor guide training last year.
Oh,
I now take people as a volunteer thing out into the forest for what's called forest bathing sessions.
mhm.
And we know that forest bathing has lots of benefits in terms of reducing stress, improving sleep, improving immune function, reducing mental health disorders, and even just 20 minutes spent outside can do that. So
Mhm.
powerful health benefits for the few studies that have been done. I was thinking, what if I did this for our patients with rheumatic disease? Maybe this could be something that could complement their treatment. So I'm interested in starting a trial for that at some point in the near future.
Oh, that sounds fantastic. And who isn't happy looking at a tree or birds flying by, right?
Yeah, exactly. No harms. I think we're realizing more and more the harms of medications. People more and more want less medicine for treatment. And this is great because the side effects are only beneficial.
You've alluded to the fact that many of these conditions related to chronic inflammation are not as well understood or diagnosed as they could be. Why do you think that's the case, and how do you think that could change?
Honestly, I doubt this was even a topic that we learned in med school because current medical training is very disease focused rather than health focused. And chronic inflammation maybe is one of those things that is lost in the cracks. We're really good at recognizing and treating disease, but we're not as good at preventing it. And so if we made that shift and focused on health, I think we could potentially have a healthier population.
It sounds like it absolutely needs to change, and it sounds like you're on the forefront of changing that. Dr. Kronzer, it was so great talking with you. Thank you so much for everything. We really appreciate it.
Yeah, you're so welcome.
It's believed that 80% of inflammatory disease is caused by factors that we can control. Eating a healthy, plant-based diet with minimal processed foods, getting plenty of sleep, getting regular exercise, and spending as little as 20 minutes or more outdoors a day have all been shown to be effective strategies for reducing inflammation. However, taking supplements has been associated with increased risk of inflammation. So if you're taking supplements, make sure there's something you truly need. The research around diet and time spent in nature is very promising, and there's so much more to be learned. And in the meantime, eating a delicious salad while enjoying some sunshine and bird songs is never a bad idea. Okay, that's all for this episode. But if you've got a question, a topic suggestion, or a follow-up question about this episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/healthmatters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy.